So I'm here with Merrin from Active Anatomy. Merrin is a physiotherapist and a Pilates teacher in Sydney. We've just taken you through a postural assessment, starting from the front.
Okay, when you're doing a postural assessment, it's very, very good to be methodical as you go through. So today we're going to start looking at the feet and work our way up through the body. So looking at the feet, the things to notice when you're looking at the feet are whether or not the toes are pointing forward, if they're turned out slightly or turned in slightly. You also want to have a look at the rolling through the feet, whether it's rolling too far outways or too far inways. The way that I tend to do that is just to have a look at the talus joint, which is here, and I feel the talus on either side. And if you roll the foot out, I can feel there's too much on one side. If you roll the foot in too far, I can see there's too much on this side, feel too much. And if you can just feel where it's even on both sides, that's how I get a good idea of where a mid-foot position is. And then if you ask the person to just relax their foot after putting them in that mid position, you can see whether they're rolling in or whether they're rolling out.
So my left foot slightly rolls out.
So if you have a look at Amy's foot, the left foot does slightly roll outwards. It looks like her arch is lifted slightly on that side. It's always good to start to make sure that the people are also with their feet almost hip width apart. I always get people to do a little walk on the spot before you even start and just get them to relax into the position where it's comfortable for them. Going up further through the legs, always have a look at the calf muscles. It's just interesting to note whether one calf is actually bigger than the other. So I think with yourself, they're both pretty much the same.
What if one was bigger? What would that indicate?
A lot of people walk or weight bear on one leg more than the other. If there's one that's very, very much smaller than the other, sometimes it's because there's been an injury on that side, and so therefore the person's loading up the other side a lot.
Right.
So you can sort of see that there may have been a problem with a knee or an ankle on that side. So it'll mean that they've been weight bearing asymmetrically for a period of time. It could also mean that they have had a history of a disc injury or a nerve problem going down that side. The sciatic nerve does supply the calf muscle, so if a calf muscle is quite reduced inside compared to the other, just check and see if there's any of that history as well. Going up from the calves, further up the legs, just having a look at the knees and which way the kneecaps are facing. So a lot of people you'll see with the kneecaps, they will want to turn in towards each other like so. And a lot of the time, it's not necessarily a structural problem, because sometimes people can have a structural turned in, especially the hip. It's called a femoral anteversion or internal rotation through the hip. Or they can have a hip joint that might be facing a little bit further forward than other people. So when they stand up, they have a structural, like internal rotation through the top half of their leg. And what you'll find those people will do is to compensate for it, they end up turning out the foot into a bit of external rotation. So they have this top one going in and the bottom one going out as a compensation.
Yes.
But what you'll find with a lot of people is the way that gravity works, it tends to pull your hip into internal rotation as well as adduction. So it pulls the hip and knee down and in and also into flexion. So a lot of people have very, very weak external hip rotators, or the turnout muscles for the ballet dancers, those deep muscles that tend to turn this whole femur outways. So if you have your feet facing forward and you see that the knees are sort of looking at each other that way, just ask the person to activate, see if they can squeeze their bottom muscles together and actually correct it. Because if they can correct it, it's more than likely just a weakness rather than a structural problem. So you can check that out. Occasionally you'll have people with their knees turned right out, which is very rare, but...
and the feet or just the knees?
No, just the knees. So you can have just knees turned out. You can have just knees turned in. You can have any variation or combination of the whole lot. If if you do see a, knee in, knee out, or one of each, just see if there's any history of injury. Like, ask what's happened in the past, like why are they walking that way, and usually they'll be able to give you a reason. Or just check out, there's got to be like a weak or a tight muscle somewhere. So all your tests, like your glute firing tests, which is part of the dynamic sort of postural assessment that I do, or seeing if they can activate their butt muscles to correct, or little things like that will show you whether or not it's a structural versus just a postural weakness that you can correct.
Do you mean standing on one leg and see that kind of
assessment? The standing on one leg. Yeah, all your dynamic postural assessments that will come following a static postural assessment.
Yeah.
So just take note of what you see. The other thing to look for in here is to look at the quadricep muscles.
Bulk.
First of all, bulk, just general bulk, because again, knee injuries can cause a difference in girth around the quads. Also, if someone is weight bearing on one side more than the other, you will get a big difference.
More muscle bulk on that side.
Yeah, that's right.
Yeah.
And if you just let your kneecaps relax there, can you see how the knees drop down when you relax?
Yeah.
If you weight bear on one leg more than the other, you see how you activate your quad on one, but you don't on the other. So it's actually interesting to have a look and see whether there's one side working or not.
So the tracking should be middle of the hip, middle of the knee, down to the second toe.
That's right.
So when we're talking about, let's say, knock knees, so the effect of having the knock knees on the muscles around the hips and the feet themselves. So if you're knock-kneed, would you say the feet would...
they pronate
they're pronating in. And the effect would be, what, the adductors tighten up?
Yeah. You from the bottom up, if you've got very pronating or turned in feet, two muscles, particularly your tibialis anterior and tibialis posterior, that run down underneath the arch of the foot to lift up the arch, they're always working, especially eccentrically, every time you land with your foot on the ground. So you're more risk of things like shin splints or plantar fasciitis type injuries, those overuse injuries.
Okay.
So if you have like a knock knee or just a pronating foot, those sort of things can be common problems. Also, if you've got that internal, the knees coming in together, you're not evenly using like the meniscus in the knee and things like that, so you can wear and tear one side of the knee out a little bit more than the other.
Right.
You're also at risk of patellofemoral pain, it's called, which is a tracking problem within the knee.
Right.
So it's really important to have that, as much as possible working towards that optimal postural alignment, that leg alignment, the middle of the hip joint, middle of the knee joint, and second toe as much as you can.
So regarding that, so we're going to have sort of adductors might be slightly tight, and what's going to happen to the hips? Are they kind of switched off slightly?
A lot of people tend to be weaker around like the pelvis, glute med area, and they do get loaded through ITB. Like, because ITB is a bit of an internal rotator, you tend to get a bit tighter down the sides.
Okay.
So foam roller releases or whatever method you use, stretches and things will be helpful for there. Yeah.
And what about the sort of bow-legged kind of posture?
You can't really change a structural knock knee or bow leg. You can't really change the bony alignment.
So what's the effect on the muscles of that sort of type of posture?
Yeah, a lot of them have. It's funny because some bow leg people will present with certain muscles that are tight, and others will have a different bunch. Like, there's not a standard sort of thing.
Yeah.
But they do end up getting a lot of shin splints. Like, they end up not having much cushioning sort of thing, and it's really important for their Achilles to be flexible, which it's not. So people have bow legs a lot of the time. They play football and soccer and things like that because they're quite fast.
Yes.
But they have very, very tight Achilles tendons and things like that. So bent knee calf stretches are really important for those sorts of people.
Okay.
But again, just the more you've got control of your pelvis, like glute med strength, especially up here, and core strength, the less load goes through the legs.
Right.
So if your alignment's not 100%, get your pelvis and your core sorted out so that the legs can work as best as they can. Yeah.
Right. Okay.
Yeah.
Good.
Okay. So
pelvis.
Yeah,
Is that the next one?
Yeah, so coming from the knees, have a look at the quads, coming up a little bit further. What I tend to do is just place my hands on top of the ilium, like going through here, and just seeing whether there's one side up a little bit higher than the other. So you can just see
this side slightly higher.
Yeah, that side's slightly high on the right compared with the left. Just bring the arms down by your side. You can see also, having a look at the gaps.
The keyhole.
The keyholes.
There's this gap here between my arm and my waist.
Yeah.
Yeah.
So you can see that it just looks like you're more squashed down, like on that side, on this side, than you are on this side.
Okay.
Just the way that that's sort of sitting up slightly just there.
So if this side was higher, the ESIS on this side is higher than this side, what muscle significance would that mean?
A lot of the time, if this side's up or this side's down, so you end up getting tighter down on this side, okay, on that side of the body, and above the pelvis is tighter on this side. So obliques, and particularly the quadratus lumborum muscle, which is just a bit further round to the back. The QL's the hip hitcher one, so lifting up,
Because that's strange, because the QL on this side feels much tighter.
That's what you said last time.
and the psoas on this side feels tighter. Yeah.
It's interesting. We'll check it out.
Yeah.
In a Thomas test.
Yes.
Or you can
see,
to see.
Okay.
It could just mean that you've got a leg length difference.
I do have a leg. I think I was told years ago when I had my gait analysed, I've got about half an inch,
right,
or quarter of an inch,
which is it's just quite a bit. I think they say a millimetre can make a difference.
Yeah.
So that's quite a lot.
Okay.
Or it could mean you have a scoliosis. So if you have a scoliosis but your legs are even, you'll still look like one leg is longer than the other because your spine isn't quite even as well.
Yeah.
It doesn't really matter.
Yeah.
I mean, it does matter, but like when you're doing just for postural assessing and program design, you really just think, okay, if this side's up, let's stretch out all the muscles up on here. I do a double stretch for those muscles, especially in the first 10 weeks or so that they do a program, and I do a double stretch on the low side to try and get the pelvis as even as possible.
Right.
Combined with core training and all the other things that go along as well.
Okay.
So that's what it could be. There's a lot of new mums have that because they're carrying their babies around on one side.
Like sort of hitching.
That's a very, very common new mum type of thing.
Yes.
And who else has that? Right hand. Are you right-handed?
Yes. Yeah.
Right hand. Emma.
Yeah.
Sorry. Right-handed people will have their right hip usually higher.
Okay.
And the right shoulder usually lower.
Or lower. Okay.
So
why is that then?
It's just a right-handed thing. If you use your right hand, just because you use your right hand to do certain things, you end up with those muscles a little bit tighter.
Right.
And it's exactly the same on the other side.
Right.
And what I find is if people stray from that, so if you tell me that you're right-handed but your left side is really high, so it doesn't fit, there's a problem. Like there is a scoliosis, or there has been a back injury, or there's something. So it doesn't ring true for everybody because people go through things in their lives.
Yes.
But a lot of the time, if you're right-handed, you will see that shoulder down, that hip high, and that's normal for a right-handed person.
I see. So that's pretty normal for.
That's fine. Yeah,
Okay,
I'm not getting too excited by that. Yeah, that's for sure. And then coming up further, the really good thing to look at front on is looking at the clavicles. You can look at chest and see whether the level of the chest and things like that.
I've seen the sort of looking at the nipple alignment. Obviously, I'm not going to do that for the purpose of this, but I've seen that sort of. Is that more for sort of men? Would you say?
Yeah, I wouldn't worry about it too much.
Okay.
If people often say to you they feel like they have one boob bigger than the other, okay, so if they say one of my breasts is bigger than the other, a lot of the time it's a rotation.
Like that?
So if you've got this shoulder coming back, but because this thoracic spine is coming forward, and that's what you'll see is like one chest will stick forward,
I see,
but the opposite shoulder, and then your head will be turned as well. You get this like real rotation through the spine, but again, it's usually a scoliosis
type thing,
structural type thing. Yeah.
Okay. Okay.
So yeah, that's the only thing I do with looking at boobs and things like that, because you can see stuff below, you can see things above. You don't have to worry about getting too personal.
Good.
Yeah.
Okay. So
looking at clavicles, because clavicles do tell you a lot about what's happening with the shoulder girdle. Look at the angle of the clavicle and see whether on one side it's going much higher or whether it's actually going straight across, or you know, if someone has a very elevated shoulder, so if you lift this shoulder up higher, you can see the angle of the clavicles going straight up to the sky, whereas this one's heading straight across.
yes.
So just check where the clavicles go, because that gives you an idea as to whether the shoulder girdle is high on one side versus the other. It just gives you a bit of information.
But the thing is, as well, I suppose, you would maybe assume the higher side was perhaps tighter, whereas actually probably in my instance, the higher side is normal because this left shoulder has been injured, so it kind of tends to fall forward and down. So it's not always the norm, isn't it? It's not always the higher side is tighter, which might mean it's the more abnormal side. In my case, the higher side is normal because this side, if I let it go, just falls back.
So you're right-handed.
Yes.
That right side should be lower. Because it's not, something's wrong. Remember how I said to you, like on the right-handed posture, if this right hip's up and that right side's down.
But there's something's wrong because this side has been injured.
That's right.
Yeah.
So if this was sitting in a normal spot, then the right side would be
normal.
And that would be normal.
Yes. Yeah.
Because it's not, we've got to have ask a few more questions and see, you know, what
about the injury on this side.
Yeah, on either side. Like it could be an injury on any side. Yeah, that's it.
And we talked about the muscle, the SCM, sternocleidomastoid muscle bulk here, didn't we, on the left?
So if you also see, like this shoulder too far forward, you'll see this clavicle way more prominent as well, just sort of finishing off the clavicles. So you look for clavicles going high and look for clavicles coming forward, because if you can really see the clavicle, that whole shoulder girdle has come too far forward.
Yeah.
And then just coming straight off the clavicle, like we were chatting, it might be a bit hard to see, but you can look at sternocleidomastoids on either side.
Can you see there?
Yeah. And just see whether
the muscle bulk.
Yeah, just have a look at what's firing up. So sometimes at rest, people will have one muscle that is switched on all the time, and if you look to the left, if you look towards the left, you see the right one fire, and if you look to the right, you know the opposite one will fire up on that side. That's right. But if you're looking straight ahead, you should have them both resting. Okay, they should both pretty much be at rest. If you do see one side firing up more than the other, either that's an indication that the head isn't straight. Like you could be looking slightly to the left or slightly to the right, depending on which one's fired up. Or a lot of times people in their jobs, if they're looking towards one direction when
they're typing or something.
they're typing or for whatever reason. Or people have their telephone on one side that they're answering, or you know, there's something in their day-to-day, or even their position they're just sleeping in. You know, they're always on the left side and they've got their head to one side or something like that.
And a lot of people think that SCM, you know, when you stretch it, it almost seems like you're stretching it by turning this way, if I was to try and stretch this one, but actually because the origin and insertion are there, if I turn it that way,